So, did you know that the historic the health reform law, Americans will be able to get the care that they need, and the insurance company will have to be held accountable for cheating their people out of money, and that with 400% of the federal poverty level, it may be eligible for the cost initiative, and the free marketplace patients can buy the services they need when they need them. Also, for women, it helps more than 20 million women get expanded coverage of preventative services such as prenatal care, mammograms, breastfeeding supplies, and women checkups, immunizations, and birth control. For approximately 15% of all Americans that are uninsured, which is slightly less than 50 million women and men and children, they can help get insured after that.
1 minute.
Many of their benefits are mandatory by law and are out-of-pocket payments, or well, not out-of-pocket payments. Healthcare plans are not able to drop people from coverage if they get sick anymore, and with it puts people back in charge of their own health care. And with the Affordable Health Care Act, 82% of nearly 16 million uninsured adults that are younger will qualify for cost assistance or Medicaid through Obamacare and the marketplace. And parents can keep their kids on their insurance for up until they're 26, even if they are unemployed or not living at home.
They're choosing what type of health care, when they want it, how much they want to pay. Instead, it's the government telling us we have to get health care. It's the government taxing us if we don't get health care.
All right, time.
1 minute to respond.
Well, it's not really the government's choice if you want birth control and stuff like that to help keep you from getting pregnant or anything like that. It's up to you, but the government will help pay for it if you do want it. And even though people are taxed for the Obamacare for other people, it's still giving other people more
30 seconds.
With their health care.
The healthcare just isn't about birth control either. Like if you go break your arm and you don't have any health insurance, then with Obamacare, that'll help pay for people that don't have health insurance to fix that broken arm, instead of saying, oh, you don't have health care, so you can't come in here.
And you are not forced to get health care. It's your own choice.
Yeah.
You will have to pay the taxes.
Time.
Okay. All right, Colin, 2 minutes to present your argument.
Right. It's very important to rely on past historical events to portray what's going to happen in the future. So starting off with the Revolutionary War, it was a war united over excess taxation. The people fought for their independence because they were tired of getting taxed. The same is happening with Obamacare. If you decide not to get Obamacare, you're going to get taxed, and that tax can rise greatly. For the minimum penalty is about $695, and that's the minimum for one person. When it came down to 2011, it was $9,500 for a single person under the age of 65. That's affecting all of us in the room. And then when it comes down to married couples, it raises to $19,000. That's double $9,000. So just think about that. If you decide not to get Obamacare, you're going to have to pay this cost, and that's more than what insurance is costing you. It's not really right. It's not constitutional. We fought for our independence so that we could have a say in our taxes, and we're getting no say at all. Do we really want to go back to the times where we had no representation in our government? I don't think so.
Obamacare is just costing America way too much money. Like Brooke said, if you don't sign up for Obamacare, then you're taxed. And that's taking away Americans' freedom. Also, the GDP will rise during a 25-year period that we have Obamacare. The GDP will rise from 14 trillion to about 24 trillion, implying that the GDP not spent on healthcare will rise from 12 billion to 17 billion in 2035. So if we just keep Obamacare, every price is just gonna go up. 2 minutes?
10 seconds.
Okay, no.
The GDP by, would you say, how many trillion?
12 billion to 17 billion.
12 billion to 17 trillion. Did you know repeal of the Affordable Health Care Act will increase the budget deficit? And Democrats cite a letter from Congress saying that repeal of the health care would lower, or would add $145 billion to the deficit. And by 2019, would add another $240 billion.
Healthcare isn't just about the money, it's about keeping the American people safe. If they're hurt, then they should be able to have healthcare to heal them. It's not just about money.
And again, you have the choice. You cannot pay the taxes if you do not have to. You can wait till you get hurt to pay the taxes. Or you can pay the taxes, let's say a farmer. They don't get hurt often. They're way out in the country. They're not the city, right? You can pay the taxes.
Okay.
1 minute to respond.
It's not the fact of you can or cannot pay the tax, it's the fact that we have to pay a tax if we don't decide to do it. You should not be taxed to do something you don't want to do. It should not be mandated that you have insurance, that's a choice. Nowhere in the Constitution does it say you have to have insurance. It's a whole socialism idea that Obama's bringing into his presidency.
To go on with what Ashley said, Obamacare is there to help people that are uninsured, but not
30
the
seconds.
people that are uninsured aren't really doing anything to get a job, to pay for their own insurance and stuff like that. Like people that are hard working, of the middle class and upper class, are being taxed of their hard-earned money to pay for people that are hurt. That's not very fair.
And with the act, 7 million Americans are gonna lose their health insurance anyway, so that's not really keeping them safe, like you said. That's a lot of Americans that are just gonna lose their health insurance from it.
Time.
Okay, I think we go to Con, right? 2 minutes. Con, 2 minutes?
Pro.
Oh, Pro, sorry.
Obamacare should not be implemented and used, Obamacare should be implemented and used by any American citizen that currently does not have health insurance or any pre-existing medical care. Obamacare has helped and provided outstanding health care to anyone that pays for a monthly plan that covers a disease, injury, or medical bills, such as hurting yourself. According to author Michael Tanner, again, repeal will increase the budget deficit. Democrats cite a letter from Congressional Budget Office that repealing the health care law would add $145 billion to the deficit by 2019 and another $240 billion by 2021. With this data, Obamacare will be used by millions of Americans currently living in poverty and those who want to switch plans. Obamacare is just a nickname for the Affordable Health Care Act passed by Congress. The President and the Supreme Court on June 28, 2012 was already passed and is now implemented currently. Many citizens feel it would be easier to not get health care for any reasons and might find it cheaper to just pay the increased income tax instead of paying the monthly health care fee. This will be allowed by
1 minute.
Obamacare and can save millions of dollars for Americans. If you're healthy and may find it less side-by-side health care is very easy to compare and makes it affordable and easy for a younger generation to relate to. The medical bills will not be forced on by hospitals.
Time.
Okay, 1 minute to respond.
Nick, you say that Obamacare or the health care provided to these citizens is outstanding. What do you base your scale on? What makes it outstanding? Do they get extraordinary coverage, dental and health, or is it just eye care? What is it? And if it is extraordinary, why does it need to be? Shouldn't it be just the basic to get these people through? I mean, we have people working their butt off to try to provide for the excess taxes to pay for these people to have insurance. Shouldn't they just be getting the minimum, not outstanding health care that's going to help them in every area?
30 seconds.
Be working and helping pay for their health care?
Also, we already have a really good insurance plan, and it's called Medicare. Like, we have to have cuts in Medicare to fund Obamacare, and with that, employer health insurance coverage will decline, and then coverage will
seconds.
be practically non-existent.
And Medicare was cut 14% this year on January 1st, or $22 billion. So that affects a lot of senior citizens.
1 minute to respond.
Lauren, do you know that Obamacare provides lower prescription costs for older people and in Medicare? On the topic of Brooke, a free market creates quality over quantity, meaning the healthcare providers fight for your business. They want to create great healthcare. They don't want the lowest, the minimum of the low. They're giving you the best healthcare because it's quality over quantity.
Can I respond?
No. No.
Wait a minute.
You asked what made it outstanding and
20
why
seconds.
it needed to be outstanding instead of,
I just wanna know where the fact is saying that, where does it say that the only people that are using this Obamacare are the people that are unemployed? Because there's a lot of people out there that have jobs that don't have health insurance, and with this Obamacare,
Time.
they're having.
2 minutes.
Actually, 10% of our population is lower class, 10%. The rest is 90%. And out of that 10%, not everyone is using Obamacare. And with that, those people, the lower class, the majority of them do not work. So those are the people using Obamacare.
Yeah, but where did you get this at?
I got it off of Gallup Politics, and Gallup polls are the most reliable polls, and that's out of our AP government textbook. How much time do we have?
30 seconds?
2 minutes.
Oh, no, man, you guys have a minute and 30 seconds.
Our premiums are gonna go up. Individuals and small businesses are likely to see their premiums double because of Obamacare, and consumers will see their premiums triple.
Nick, you said quality over quantity. These insurance companies, yes, they are providing cheaper healthcare, but this cheaper healthcare is also making people lose jobs
1 minute.
within the industry because they don't have enough people to help pay to be on board and be insurance providers. They're having to cut people because their insurance is so cheap now. It's hurting our economy. It's not helping.
Not the best either, because you don't even get to pick your own doctor. They're picked for you, and they're not gonna be the greatest doctors out of the whole country.
Private practices will basically not be a thing anymore. What do these people go to?
30 seconds.
What do these people go to school for to get paid $200,000 to be a degree to have a doctorate? I mean, it's just a waste of money if Obamacare is just gonna stampede over all of that. Everything, they're gonna get paid the same amount for someone who's at the low bottom or at the top, it's gonna be the same.
10 seconds.
1 minute to respond. 1 minute to respond.
okay, so you keep talking about money and how it's taking a lot of money from all these other things and how it's reducing the size because of money. What about the people who aren't really, they don't make enough to really get their own health insurance? And yeah, people are gonna get taxed, but wouldn't you rather be taxed a little bit than to not be able to afford the health care that you need or whatever? I mean,
And just raising the tax a little bit will save thousands of lives. And I think that's well worth it. Well worth it.
Okay. 10 seconds.
Taxes can save lives.
Yeah. God. Time.
Time, 1 minute to respond.
Raising the taxes shows Americans that work ethic is worthless. I mean, basically, you can live off the government and have a perfectly comfortable lifestyle, or you could go out, work, and help support the people who don't work. I mean, it's your choice.
And again, it's 10%. Like,
The
that's the
entire
lower class,
population.
like, that's 10%. That means 90%, majority of all of us are gonna be paying more just for that lower 10%.
And 82% of working Americans are already covered by some type of health insurance.
20
A lot
seconds.
of us don't need Obamacare. And I'm gonna be honest, I'm not gonna work hard and get a hard-working job to pay for someone's broken arm. I'm not gonna do that.
10 seconds.